So there's a lot of legwork right now, and I really haven't done it yet, but I can foresee it happening, which I'm kind of looking forward to.
Mm-hmm. Mm-hmm. So when did you start doing some planning on the computer?
Well, actually, this happened Saturday night,
Uh-huh.
and so we had a big talk on Sunday, my wife and I, and this is one of the things we kind of talked about, that I kind of brought up. We kind of mutually did it.
Mm-hmm.
And it looked like it just sort of just took the, I don't know, kind of leveled things off for us a little bit, took the job thing out. And
so this started happening.
So I just started messing around then with the computer that night, just coming up with some kind of an outline or something, and she was kind of helping me a little bit.
Yeah. So this was after the big blow up and getting arrested.
Right.
And you came home from jail, and how did you, after that trouble with your wife, the fight, getting arrested, that must have been very upsetting. So how did you get yourself to sit down at the computer and start doing that?
Well, it just seemed like the right thing to do. We had talked, and we hadn't talked in months.
Mm-hmm.
And it was like I had license, and I felt like I could do something, or so I don't know. We just felt better, and just that idea of the prospect of possibly doing something like that with her support, it was kind of like us in old times, a little bit.
I see.
And I mean, I'm not saying that I sat down for all night. I mean, I just messed around for a little bit.
It was a start.
Yeah.
Mm-hmm.
Right.
Mm-hmm. So how is that different from what you'd been going through the previous 6 months, or even the last month or two, as you've been grappling with your employment situation?
Completely different. I never touched the computer after the first month. I never tried to organize my time. I didn't do anything like that. I just started to feel worse and worse, and I don't think I ever felt as if I had the energy or the desire to actually create something or come up with something.
Uh-huh. So then you weren't considering having your own business, private consulting business, as an option?
No, not at all.
Uh-huh. So you were still looking to get another job with another.
Right.
And you're in what business?
Insurance.
Insurance. So
Sales,
you were
right.
looking to get back with another insurance.
It's all I had really ever done.
Yeah.
And I guess I knew what I was doing, but I was an employee. I was a salesman, and I worked for the same people for years.
Yeah. So this is just really new for you, the idea that you don't have to work for somebody else. You can work for yourself.
Well, if it works, yes.
Yeah, yeah. Well, you said 6 months, if things are working.
Yes.
That you'll have 10 or 15 clients that you're calling on regularly, making contacts. Anything else that would tell you in 6 months that, hey, this was a good idea? This looks like it's going in the right direction.
It would be nice if in 6 months, and if this was something that looked like it was going to work, that we decided that we could schedule a vacation, and probably next December or something. Or at least we could schedule it.
Okay. So taking regular vacations, something you and your wife and your family did before, but you put on hold now that you've been unemployed.
Right.
So that's something you could be looking towards the future, hopefully.
Right.
Yeah. So you started working on the computer and outlining some ideas. You've talked to some people in the business. What other kinds of things then will you have to do to get to that place in 6 months?
I will have to get up early every morning, work out. I have to do that.
For your own
For my
feeling
own,
good about
for my
yeah.
own, right.
Yeah.
To continue feeling this way and to want to continue to try to work toward a goal, I need to feel good.
Mm-hmm.
So I'll need to do that. I need to spend time with my wife, to go out on the weekend, or at least a weekend night or something, to do something, rather than just hiding like I've been doing.
Mm-hmm.
I'd like to play golf regularly.
Mm-hmm. Mm-hmm.
But I'm afraid a lot of this stuff, though. You know, I'm just afraid of a lot of it.
Mm-hmm. Well, what's that about?
Just a part of me is afraid that it's not going to work.
Mm-hmm.
And I'm living a dream, or I'm thinking about a dream. I don't know what choice I have, but I don't dare tell her that. But
Mm-hmm.
that's, I
Yeah.
am very worried.
Yeah, yeah. You know, that sounds reasonable to me to have some worries and anxieties about that. This is going off in new territory for you.
Right.
Yeah. When was there a time that you can recall that you had some worries, you were scared about going off into new territory, and you went ahead and did it anyway, and it turned out okay? Well, tell me about a time when that happened for you.
Well, actually, just about every time that I had to investigate a new account or to try to meet personnel at a particular company, or each time it was really difficult, but when I did it, even whether it worked or not, I felt much better.
Mm-hmm.
And that happened a lot. I mean, that was just part of it. It's part of
Mm-hmm.
the job.
So this is something you do regularly, have done regularly in your old job for 20 years.
Yeah, but I had a job then, though. I mean, if I didn't work,
sure.
I could go somewhere else.
Yeah.
Or I could go to the next place, or the next place, or the next
You're right,
place.
yeah. But you did it. It sounded like you did it a lot, and
Right.
sometimes it was more difficult than others. How did you do that? How did you get yourself to, despite feeling worried, anxious, make the contact and follow through and do the job?
Well, I think that knowing that whether it worked or not, or if I had a successful sale, I was going to go home to a good dinner, and I would get up and I would exercise, and I think about that stuff. I used to think about that stuff a lot, and it was kind of something that provided a comfort. And that helped me through a lot, knowing that I had that.
Mm-hmm. Mm-hmm. And anything else you do to get yourself to go ahead and kind of, despite the anxiety and worry, anything else you do?
Well, yes, I would research as best I could the company,
Mm-hmm.
Go in there with as much information as I possibly could get, and that would increase my confidence.
Mm-hmm.
One thing that I vowed years ago, which has served me well, is no matter how afraid I might have felt or how hesitant, is I did it anyway.
Mm-hmm.
So there was
Wow.
never the option of not doing
Yeah.
it.
Mm-hmm. Mm-hmm. You know, you usually think about somebody who's a consultant, regardless of what the business is, that they're an expert in that area. Or else they couldn't be successful at that and make a living at it. And so you've been in insurance for all these years, so you know insurance. Sounds like
Right.
really well inside and out.
Mhm.
It sounds like another thing that you're expert on is how to be successful despite worries and fears, how to overcome those, how to do it anyway. That's a skill that is not
Yeah, I pretty
something
much try to
everybody
do that,
has,
yeah.
you know.
I didn't think I knew I was doing it, but I guess that's what I did.
Mm-hmm. Yes, I think you've developed some really good ways for knowing how to get the job done and do it well despite whatever fears and anxieties you might have. Sounds like you've developed quite an expertise in that as well.
Well, never thought about it that way.
Mm-hmm. Mm-hmm. I want to come back to something before we take a break in a few minutes here. In terms of the fight you and your wife had and the argument and you hitting her, have there been any other times in the past you've ever hit
Never.
her, anything like that happen?
Never.
So, how have you been able to keep from doing that in your relationship with your wife? Unless this was the first argument you and your wife have ever had.
No, it wasn't the first argument, certainly.
Yeah, yeah.
It was just an unspoken law, I guess, or just an understanding between us that would never occur in our relationship.
Mm-hmm.
And so we would argue, but we really didn't argue to the point where that was ever a possibility until the last few months. And it wasn't her, it was me.
Mm-hmm.
And I felt this coming on, and I was kind of scared of what I might do. So there were times when I would purposely not talk to her, or if she said something, I would lock myself in, or just go in the bedroom or something,
Mm-hmm.
because I knew things were not right inside me. And so I would avoid her a lot.
Mm-hmm. So that was your way of trying to make sure
I didn't lose it, right?
you didn't lose it, rather. Yeah. Anything else you did to try to keep from losing it even when you were around her? You couldn't avoid her all the time. So when you were with her, what would you do?
You're talking about just the last few months?
Yeah. Yeah, because it sounds like that's
Right.
when it hasn't ever been an issue, even a remote possibility in years past,
Well,
from what you're saying.
I know that I had very good teaching when I was a child, and I know that one thing that I have tried to do, I wasn't always successful, one thing I've tried to do is to, when things aren't working, to just try to be affectionate or be supportive, regardless. I've tried to do that. I haven't been able to do that.
Mm-hmm.
Now that things are not working, and they haven't been working, I didn't feel like being affectionate at all. So that was missing in me. I just couldn't say, you know, to heck with this, let's just play Uno.
Mm-hmm.
I couldn't do that. I used to do that.
Mm-hmm. Mm-hmm.
So I would just leave, or I wouldn't try not to talk to her.
Mhm. So what has worked best for you in the last few months to keep from losing it?
Getting away from her.
Mhm. Mhm. Okay. And so when you had that big blow up a few days ago and you hit her,
Mhm.
that wasn't possible for you?
Probably was possible.
Mhm.
Sure, it was possible. And I could have just gotten out of there,
Yeah.
but I didn't.
Mhm. Mhm.
I just didn't really care.
Mhm.
I did care. A large part of me did, but a part of me really didn't.
Mhm. What was different? What was going on then?
I think I just lost hope. I think I just lost hope. I looked at her and I felt anger. And I just chose not to walk away.
Mhm. So it sounds like you're feeling more hopeful now about your employment situation.
Yes.
Mhm.
And I really don't like to talk about that, what happened.
I see.
It's not a good feeling.
Mhm.
It's not a good feeling.
Mhm. Well, as you're more hopeful about your future work situation, as you put energy into developing your own consulting operation and putting work into that, what can you do to prevent getting to the point where you start worrying about losing it?
Stop drinking.
Hmm?
Exercise regularly. I haven't been doing it all. Spend a lot of time, quality time, working at developing this business.
Mhm.
And I think what I'm going to need is to spend a regular day. I mean, I've read some books on this. Spend a regular work day and treat it as a work day. I have to do that. And I have to rely on myself, and I have to do it.
Mhm. And how about as things come up with your wife? I mean, what I heard you say, then it's only been in the last few weeks, months most, that you're feeling hopeless, and you felt that the best way to deal with things as things came up with your wife was to get away from her.
Right.
How about when things would come up in the past, and you and she, differences that you had, and you and she were able to successfully deal with those differences and work through them? What would you do to make that happen? How were you able to help the two of you get through things in the past when things were more normal and hopeful?
Well, I don't think that things ever got to that point where they were so intense, or there was such anger or frustration as there had been. But we listened. I listened. I
Mhm.
listened to
Mhm.
her, and she listened to me, and we really listened. If we thought we were getting too upset or it was going the wrong way, one of us usually said, let's just put this to bed. And it would usually work.
Mhm.
And I was able to do that. I was able to do that for a long time. So was she.
Mhm.
But that's one thing that hasn't been there last.
Yeah, but times were better then.
Times were better
since
then,
then. Yeah.
right.
And now you're starting to get your hope back about
Right.
the future, about your job situation. And as you start working towards setting up a successful consulting company,
Mhm.
how will you and your wife work together to make things work in your relationship as you are also making things work in your business?
Well, we've talked about that, and
Okay.
we have made a date. We're going to be together every Friday night, come hell or high water,
Mhm.
and we're going to do something completely different than business or home or something. We're going to do something every Friday night or that weekend, either go camping or we're going to do something we just haven't really done. And just the fact that we're going to do that, I think, has helped us,
Mhm.
knowing that we're going to be together and that it's important.
Mhm. Okay. So as you and your wife are doing that, how would that be for your kids? Or your son? You mentioned your son.
Well, I certainly can't speak for him, but I could speculate that it would make a great deal of difference as far as how he feels about things.
Mhm.
I'm sure he can't feel good about what's happened here.
Mhm.
I haven't talked to him since Saturday night, but I know he knows.
Yeah, I mean, I know he's off college, but
He knows.
he knows. Yeah.
He knows.
Yeah.
And I'm not looking forward to that
Uh-huh.
first conversation, really.
Mhm. With your son.
Right.
Yeah.
I am looking forward to it, but I'm talking too much about what happened.
Yeah. Sound like you have mixed feelings about that.
Well, yeah.
Yeah. And once you have that conversation with your son and it's successful, get through it okay, then how will he be about things?
Oh, he'll be the same as he always is, very stable, very good kid.
Mm-hmm.
He'll work out.
Uh-huh. Yeah. Okay, you mentioned all these things that are going on with you now, you know, the employment situation and problems with your wife and some drinking, depression, some suicidal feelings. That's where you've been.
Right.
And as you describe the future, your consulting company will be coming along. You and your wife will be doing things together. You have a regular date time
Right.
now. You and your son will be playing golf.
Mhm.
You'll be playing golf with your buddies,
Right.
things like that. Okay, so let me ask you one more question, then we'll take a break. Given that this is kind of where you're at now, and this is where you want to be, on a scale of 1 to 10, well, I want to say where you're at. This is where you've been recently. Sounds like you're at a different place today than where you were. You've been making some movement. So on a scale of 1 to 10, with 1 being where you have been up until the last couple of days.
Saturday night.
Yes. Okay. And 10 being where you want to be in, let's say, 6 months. Where would you rank yourself on that scale today?
Realistically, 2.5.
Okay. So you're at a 1 last Saturday night,
Right.
and today you're at a 2.5.
Right.
Okay. Okay. What would it take for you to move up to 3 or 4?
got an account.
Mm-hmm.
Well, if I got an account, I'd probably be at 50.
Mm-hmm. I mean, it sounds like that you still have some groundwork to
Yeah, there
lay
is.
for
I'm
that.
speaking
So
ahead of myself
I'm
there.
thinking of more short term.
Right.
That it's they can still make movement on that scale in the next few days or a week or so as you're working towards that goal. So
Okay.
what would a 3 or 4 look like, and what would it take for you to get there? How would your wife and others
Okay.
know that you were at a 3 or 4?
I will have spent productive days, a week or two, every day. I'll have something to show for it, which I will share
With your wife?
with my wife.
Uh-huh.
I will have been moving toward this goal. I'm going to try to make everything as productive as I can. I'm going to do a lot of reading. I will have worked things out with my son,
Mm-hmm.
or at least had a discussion.
Yeah. So if you're doing those things, when you're doing those things, where would you be on the scale then, with the 1 to 10 scale?
If I did those things, and that was for a couple weeks, and I would be 3.5.
3.5. Okay. I'll tell you what, I'm going to take a few minutes break,
Okay.
kind of collect my thoughts here, and then come back in and spend a few more minutes, and we'll wrap up
Okay.
and schedule another meeting time.
Okay.
Okay. All right. Hi, Glenn.
Hi.
Thanks for being patient here. I just find it helpful to just step outside and collect my thoughts. Just a lot of things have been going on with you. So to try to sort things out and make the best use of our last few minutes together. First, I'd like to tell you that I'm really impressed that you came here today. I know you mentioned in the beginning how difficult it is for you to do this kind of thing and to talk about problems and what's going on with you. And I know coming here and doing something like that is not easy, and you were able to do it and do it anyway. And then I think it shows a lot of strength and good judgment to do something like that. And also, I realize that a lot of things have been going on with you for 6 months, and especially in the last few days, since last Saturday. But you've been able to start making some plans and doing some specific things to start moving towards in future direction that's more hopeful. That is hopeful. That you haven't been hopeful the last few weeks or months, and how since Saturday things just came to a head, and